Good afternoon, and welcome to Live Healthy Miami Gardens Facebook Live weekly health and wellness series brought to you by the City of Miami Gardens, Live Healthy Miami Gardens. Our goal is to bring our community information and resources to help us make the healthiest choices possible for ourselves as a Miami Gardens community and our families. My name is Ketia Harris. I'm Community Health Data Specialist at Jessie Trice Community Health System, Program Manager for our Breastfeeding Touchpoint program based out of Jessie Trice Miami Gardens, Barbara Jordan Clinic, member with Live Healthy Miami Gardens, and your host for today. Live Healthy Miami Gardens was born from the realization that although health is largely influenced by our individual choices, the conditions in the communities where we live, learn, work, worship, and play are also major contributing factors to the racial and ethnic health disparities and healthcare disparities faced, as well as our overall ability to make healthier choices. We know that these conditions are systemic, historical, and continue to impact us as communities of color and as a whole here and now. Live Healthy Miami Gardens is a community initiative and part of the city's efforts to address these conditions and reduce poor health outcomes through the transformation of policies, our environment, and the healthcare system overall, making the city of Miami Gardens a healthier place to be. Joining us today is Cristevy VidalGomez, a mother of three breastfed babies who have worked at the Miami-Dade WIC program for 7 years as a breastfeeding peer counselor. Then in 2020, she became an IBCLC or International Board Certified Lactation Consultant and is currently working as a lactation consultant with the Miami-Dade WIC program. Cristevy, thank you so much for joining us today. Can you tell us a little bit more about yourself and what you do? Or did I sum it up
Thank,
already?
thank you so much for having us today. As you mentioned, I'm mother of three and also an international board lactation consultant at the WIC office, Miami-Dade, and we are here basically helping moms to meet their breastfeeding goals.
Thank you. And just a little bit of information about the WIC services. Are they free or how would moms be able to access those services?
WIC is completely for free. It's basically based on income and eligibility income. It has to be women's. The program is designed for women's, infant, and also for children under 5 years.
Okay. Thank you. And for those joining in, if you got the notification, you know that we're talking about breastfeeding and the love hormone. It is, Valentine's Day already passed, but it's also Black History Month, Heart Health Week, Lovey Dovey Month. What is oxytocin and why is it called the love hormone?
So oxytocin is basically a hormone produced in the hypothalamus and it's released by the bloodstream into the bloodstream by the pituitary gland. With it helping with childbirth, it helps with breastfeeding, and it calls the love or hormones, the love hormones, or also anti-stress hormone, because increasing, when having sex, during birth, during breastfeeding, each one with different categories, but interfere in those three actions specifically. Oxytocin release with mom-baby interaction, baby develop of trust. It lowers the bloodstream pressure for the mom, cortisol level as well, and it helps to decrease postpartum depression for moms.
Okay, thank you. And what does it do more specifically for lactation between or breastfeeding experience overall with mom and baby, for mom and baby?
Okay, so you know that we have little factories of milk inside the breast, and I'm gonna take this as an example. Let's imagine this is the alveoli, the little, factory breast. So when oxytocin increase, that release an stimulus that contract that alveoli, right? So it helps with the leg down of the breast milk. It helps to send the breast milk directly to the breast. Also helps to bonding between mom and the baby. It helps with sensory stimulation and socialization for the baby. Relaxes mom, also relaxing the baby when we are breastfeeding. So it basically also reduces moms that are breastfeeding feels less pain because of that hormone.
Okay. And is where can oxytocin be found, or how is it produced? Is it just in the breast? Is it in the breast at all, or how does that work?
It's in the hypothalamus and it responds to a stimulation. It responds to baby touching the mother's breast. It helps, and I think that's also one of the questions. It triggers when the
Yes.
baby touch the breast. It triggers as well when the mom smells the baby, when the mom smells something that has baby smells. Also, during postpartum depression, it helps with contractions, and mom has less bleeding because of the release of the oxytocin.
Okay. And is it triggered the same way, or is it?
It is the same way. It triggers when the baby latches on and the baby starts with the stimulation on the breast.
Okay, thank you for that. Very informative. And just to see what all that, how oxytocin overall um helps with the if I'm understanding, the letdown and just the whole breastfeeding and lactation experience with the mom and baby.
Yes, it helps. It's basically what I was telling you that when the mom receives that stimulation, the
Mhm.
body and it responds, contracting the alveoli on the breast and sending the milk. So that is when we have the leg down of the milk. So basically helps to bond with the baby. It helps to release the milk um, with the interaction of prolactin as well. So it's basically oxytocin and prolactin manage all the breastfeeding.
Okay, awesome. Thank you for that clarification. And we're going to make a slight shift. I know WIC Miami-Dade County has worked with different several partners, but also has some initiatives of their own in supporting and encouraging Black pregnant and breastfeeding families to initiate breastfeeding. What are
Mm-hmm.
initiatives that are in place to support Black pregnant and breastfeeding families?
So you know that, and I'm gonna take as a sample the community in Liberty City. We have the lowest level non-Hispanic non-Hispanic Black families. So we have the lowest rates in breastfeeding over there. So with the quality team, we have a project, we have an outreach to help increase the breastfeeding levels and the breastfeeding rates in that community. So basically, we are supporting the families. We are having policies to implement into the community to help specifically that community. Okay, so we also have we have been identified and review our policies, our bias that we could have as an employee, so that way we can include everybody and we can increase the rate of breastfeeding. So we are working really focused on the community.
Okay, is this a initiative where other community can get involved in, or even the families can get involved in?
Oh, sure, sure. We also have one of the things that we are doing is that we have a support group into the community. It's on it's virtually. We do it every the second and the fourth Friday of the month. It's at 3 p.m. with one of our amazing peer counselors at the WIC office. And from that specific, from that group, we also have breastfeeding advocates, which are basically peer-to-peer support. They are moms that were part of the support groups, and now they are working with the families in the community, helping increases the breastfeeding help. I mean the breastfeeding rate.
Beautiful. Thank you for that. And what if mom or families need additional lactation and breastfeeding support? where can you be reached?
So we have different ways that families can reach us. We have the breastfeeding helpline, which is the phone number that you see here, over there. Okay, it's basically the 786-336-1336. It's a breastfeeding helpline, and it works 24 hours, 7 days during the week. Just leave a message. We call you back as soon as possible. We also have our social medias. You can follow us in social media through Miami-Dade Week. Just follow us. Instagram and Facebook as well. We also have the website, which is miamidadeweek.org. And, we have lactation consultants completely for free. And we also have a breast pump program to help moms when they need to go back to work, at school, and also when babies need to stay at the hospital for medical reasons as well.
Okay. And do you have, I know this is a quick live, but do you have any final thoughts for our breastfeeding families or for the community, or just anything you want to share before we wrap up?
So basically, breastfeeding is a relationship, is a bonding we do. I mean, we have been, sometimes we like it's only for mom and baby, but it also helps in the community because we are lower the risk of mortality as well. And we are, helping the planet. There's a lot of, benefits about breastfeeding, and those two, just to mention really, brief about those. But just, if you need help, don't go and just do whatever is, the faster way. Just try to find out what's going on with breastfeeding. Call the WIC office. We are here to support you. We are here to help you, and that way you can meet your breast goal.
Okay. Thank you again, Cristevy. I really appreciate you being on here, sharing important information for our families to take and utilize, and I hope will help improve their breastfeeding experience, make it a more joyful one, positive one. Thank you all who did tune in. If whether you're tuning in live or you're watching the segment after the fact, feel free to follow Live Healthy Miami Gardens here on Facebook and YouTube, where we also go live every Tuesday at 3 o'clock p.m. And check out some of our other videos on breastfeeding and other health topics. We're also on Instagram, Twitter, and you can find us also at livehealthymiamigardens.com, offering more health and content resources. Until then, have a great rest of the month, rest of the day, rest of the week. A happy Tuesday, 2/22/22 on a Tuesday. I don't know. I know that was corny, but whatever it is, enjoy it. Enjoy it, and thank you again.